Khial-Kap, also known as wind attacks, is a cultural syndrome observed among Cambodians both in the United States and Cambodia. As described in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, the condition presents with symptoms similar to panic attacks, such as dizziness, heart palpitations, shortness of breath, and cold extremities. Additional symptoms related to anxiety and autonomic nervous system arousal, like tinnitus and neck pain, are also common. These episodes are believed to result from the movement of khial, a wind-like substance, rising through the body and bloodstream, potentially causing severe physical consequences. Attacks can occur suddenly and often align with diagnostic criteria for panic attacks. Research published in Culture, Medicine and Psychiatry highlights that Cambodian refugees with post-traumatic stress disorder frequently report experiencing these attacks, which are often accompanied by intense fears of death due to bodily malfunction. Khial-Kap exemplifies a cultural syndrome, a cluster of symptoms that commonly occur within specific cultural contexts or among particular cultural groups. Kufungisisa, which translates to thinking too much, is another cultural syndrome recognized in the DSM-5 and is primarily observed among the Shona people of Zimbabwe. Across various cultures, excessive thinking is often viewed as harmful to both mental and physical health, commonly linked to symptoms such as headaches and dizziness. Kufungisisa involves persistent rumination on distressing or worrisome thoughts. Within its cultural context, it is seen as a contributing factor to anxiety, depression, and physical complaints. For example, someone might say, "My heart is painful because I think too much." It also serves as an idiom that reflects interpersonal and social stress. The concept of thinking too much is a widespread idiom of distress and explanatory model for suffering in many cultural settings, including communities in Africa, the Caribbean, Latin America, as well as among East Asian and Native American groups. Clinical lycanthropy is a rare psychiatric condition in which individuals hold the delusional belief that they can transform into an animal, most commonly a wolf or werewolf. The term is derived from the mythological concept of lycanthropy, where a person is thought to physically shape-shift into a wolf. Those experiencing clinical lycanthropy may believe they can become any specific animal, not just wolves. During episodes of this delusion or accompanying hallucinations, individuals may behave in ways that mimic the animal they believe they have become. For example, acting like wolves and wandering into forests or remote areas. According to the Journal of Neuropsychiatry and Clinical Neurosciences, clinical lycanthropy is classified as a form of delusional misidentification syndrome, in which a person misperceives their own identity or physical form. Depersonalization, derealization. Disorder is characterized by a persistent sense of detachment from oneself, the environment, or both. Individuals with this condition may feel as if they are observing themselves from outside their body, or they may perceive the world around them as unreal, distorted, or dreamlike, experiencing sensations such as time moving unusually fast or slow. Either depersonalization, feeling disconnected from oneself, or derealization, feeling detached from surroundings, can occur independently or together. For a clinical diagnosis, these symptoms must be ongoing and not just brief or occasional. As noted by Psychology Today, temporary experiences of depersonalization or derealization can be common and are often triggered by medication side effects, recreational drug use, or other physical or psychological conditions. Diogenes syndrome is primarily characterized by compulsive hoarding of rubbish and seemingly worthless items. It is most commonly seen in older adults and is often linked to progressive forms of dementia. Additional symptoms include severe self-neglect, apathy, social isolation, and an apparent absence of shame or concern about one's living conditions. The term Diogenes syndrome is actually a misnomer. It is named after the ancient Greek philosopher Diogenes of Sinope, a founder of Cynic philosophy. However, Diogenes did not hoard or isolate himself in the way the syndrome implies. Instead, he deliberately rejected material wealth, status, and possessions, choosing to live in voluntary poverty. He famously slept in a large ceramic jar and actively engaged with society, finding virtue in simplicity and self-sufficiency. Stendhal syndrome is a condition in which individuals experience intense physical and emotional reactions, such as anxiety, panic attacks, dissociation, confusion, and even hallucinations when confronted with art. These responses are typically triggered by exposure to artwork perceived as especially beautiful, or by encountering a large volume of art in one concentrated setting, like a museum or gallery, according to Medscape. In some cases, similar symptoms can also be brought on by the overwhelming beauty of natural environments. The syndrome is named after the 19th century French writer Stendhal, who reported such experiences during a visit to Florence in 1817. It is also known by other names, including hyperculturemia and Florence syndrome. Apotemnophilia, also referred to as body integrity identity disorder, is marked by an intense and persistent desire to amputate healthy limbs or other body parts. Although the condition is not fully understood, it is thought to have a neurological basis, with some research suggesting a link to abnormalities in the right parietal lobe of the brain. Individuals with apotemnophilia may go so far as to injure a limb in order to necessitate medical amputation. Treating the disorder is particularly difficult because many affected individuals do not seek help. However, when treatment is pursued, approaches such as cognitive behavioral therapy and aversion therapy may be used in an attempt to manage the condition. Alien hand syndrome is a rare neurological condition in which a person perceives one of their hands as having a will of its own. Although sensation in the hand remains intact, the individual feels that the limb acts independently and is no longer under their control. People with this condition often describe the affected hand as if it were a separate being, sometimes even assigning it its own personality or intentions. Meanwhile, the unaffected hand functions normally under conscious control. This syndrome is most commonly associated with damage to the corpus callosum, the structure that connects the brain's two hemispheres. It can also result from a stroke or injury to the parietal lobe. In such cases, the hands may appear to work against each other, a phenomenon known as intermanual conflict, or a form of ideomotor apraxia, where involuntary movements oppose the person's intended actions. Capgras syndrome, named after French psychiatrist Joseph Capgras, who studied the illusion of doubles, is a psychological condition in which a person believes that someone close to them, typically a spouse, family member, or friend, has been replaced by an identical imposter. This delusion is most commonly seen in individuals with schizophrenia, dementia, epilepsy, or following a traumatic brain injury. Treatment generally focuses on addressing the underlying condition and may involve the use of antipsychotic medications, along with other therapeutic strategies tailored to the primary diagnosis. IWS, also known as Todd syndrome, is a neurological disorder that causes distortions in perception related to body image, time, and space. Individuals with AIWS may experience hallucinations, sensory distortions, and a changed sense of movement or speed. The most common symptom is a distorted body image. People may feel uncertain or confused about the size and shape of parts of their body. These perceptual changes can be deeply unsettling, often triggering fear or panic. AIWS is frequently linked to conditions such as migraines, brain tumours, or the use of certain drugs, and it most commonly affects children between the ages of 5 and 10. Dissociative identity disorder, previously referred to as multiple personality disorder, involves the presence of two or more distinct identities or personality states that alternately take control of an individual's behaviour. Each identity has its own characteristics, memories, and sometimes even a different voice or mannerisms. This identity disorder is most commonly associated with severe trauma in early childhood, prompting the mind to develop alternate identities as a way to cope with overwhelming stress or abuse. Common symptoms include sudden shifts in personality or behavior. There could also be gaps in memory or unexplained blackouts. Also scarily, a sense of detachment from oneself or from reality. Histrionic personality disorder, HPD, is a long-standing mental health condition marked by persistent patterns of attention-seeking and overly dramatic emotional expression. It typically begins in late adolescence or early adulthood and often persists throughout life, with treatment proving challenging in many cases. Individuals with HPD tend to place great emphasis on their appearance, display intense emotions, and constantly seek validation and approval from others to feel valued. Common signs include heightened sensitivity to criticism, intense and often exaggerated emotional responses, ongoing need for attention and recognition. Cotard's delusion, also referred to as Cotard's syndrome or walking corpse syndrome, is a very rare and severe mental health disorder in which individuals hold the false belief that they are dead, do not exist, or are physically decomposing. In some cases, they may also believe they have lost internal organs, blood, or body parts. This condition is frequently associated with major depressive disorder, psychotic episodes, or schizophrenia. Common signs of Cotard's delusion include a fixed belief of being dead, rotting, or empty inside. People with this syndrome may severely neglect their personal hygiene and refusal to eat. It can also include hallucinations involving deceased individuals or visions of decay. Exploding head syndrome, EHS, is a benign sleep disorder where individuals perceive loud, explosive sounds during transitions between sleep and wakefulness. Though frightening, it is not harmful and typically resolves without treatment. So, what is it? EHS is an auditory hallucination, often described as a gunshot, loud bang, or crashing sound, sometimes accompanied by flashes of light or muscle twitches, and will typically occur during the transition from wakefulness to sleep, or sleep to wakefulness, and lasts only a few seconds. The exact cause is unknown, but possible factors include neural activity during sleep-wake transitions, ear-related issues, or rapid medication withdrawal, for example, benzodiazepines or SSRIs. Or it could be due to stress. There is no treatment for EHS as it is harmless and doesn't cause long-term health problems. However, it is recommended to seek support from a doctor if episodes are frequent or distressing and need help improving sleep hygiene. If you experience EHS, consult a healthcare professional to rule out other conditions, such as seizures. Coro syndrome is a culture-bound disorder marked by a persistent fear that one's genitals, or breasts in some women, are shrinking or retracting into the body, often accompanied by a fear of death. It is most common in East and Southeast Asia, but can occur elsewhere. Key features are fear of retraction. The primary symptom is the belief that the genitals are shrinking or disappearing. Fear of death. This belief is linked to the fear that retraction will lead to death. Cultural context. Coro is connected to cultural beliefs about sex, reproduction, and male potency, anxiety and panic. Affected individuals experience intense anxiety, panic, and sometimes psychosis. Physical manipulation. Some attempt to prevent retraction by manipulating their genitals, which can lead to injury. Epidemic outbreaks. Coro may occur in clusters, often in specific regions. The treatment for this disorder is usually psychotherapy and will be able to address the psychological aspects, alongside treating any underlying psychiatric conditions like anxiety or depression. Coro is not a physical condition, but a psychological disorder, and the intense fear can lead to harmful behaviours and significant distress.